name is Dr. Ebba Kadir Ebba. I'm the president and founder of Gemini Healthcare Group. Through the support of many of you and dedicated volunteers and board members of Gemini, over the past few years, Gemini has been able to make a tremendous strides in affecting the lives of Ethiopian children and their families. For many of us, the small steps that we've been taking has sown the seed for a journey of a lifetime. A journey filled with commitment, passion, personal sacrifice, as well as rewards sprinkled with little miracles along the way. Armed with a compassion for children and a vision for improving the lives of those less fortunate across the globe, the founding members of Gemini gathered in Atlanta a few years ago to lay the foundation for the organization. Through hard work, personal and financial commitment, as well as through the support of dedicated individuals and organizations like you, Gemini is well on its way to becoming an effective healthcare organization, advocating on behalf of children of Ethiopia and providing vitally needed medical and educational services. In the next few minutes, let's take a journey looking back at the work that we've been doing in Ethiopia and seeing the realities on the ground. The journey may have started with Gemini, but it's our collective responsibility to make a difference. Just remember, we may not change the world, but we can save a child in Ethiopia and in our respective communities. Thank you.
Gemini Healthcare Group, as you probably know, is a non-profit healthcare group that is established in the U.S. We have three main purposes. One is education of the Ethiopian physicians. Second one is providing services that do not exist by bringing in specialists to Ethiopia, not only to do the service but also to do the training. And the third is as important project that we have. Our goal is to build a pediatric or children's hospital in Ethiopia. Where we are right now in terms of the third objectives is we have the land ready to build a 120-bed specialty pediatric hospital. We have the design ready, so it's almost ready to be built. God willing, if everything is in order, hopefully within the next 2 years, that's going to become operational. We are here at the kids' playroom at the Black Lion Hospital, 7th floor, with the kids, the long-term residents of this hospital. And when Desi and I, you see over here, when we came in a little over 2 years ago, we saw Zeman, who is now 9. Zeman right here that you see has been living here for over 9 years. He has that tracheostomy, or that little breathing tube that he has, that he was not able to go home because it was not safe for him to go home for. So because of him, we were able to start this playroom with the help of in collaboration of Healing the Children Greater Philadelphia chapter. As you can see, most of these kids, almost all of them have their trach, which is a breathing tube without which they cannot survive. Unfortunately, they were not able to go home because these trachs, or their breathing machine, cannot be reversed safely. So while they're staying here in the hospital for many years, like Zeman, he's been here for 10 years, are not doing much at the hospital. So having this playroom as well as educational room is going to be essential for their growth and development. So as you can see, these young, beautiful kids with medical situation can be safely and rightfully treated in a hopefully happy environment. Hospitals are, as it is, not a fun place, it's a sick place, but like our friend here, they can do a little, they can take a little time out of their day to play and be kids again. Maybe Desi could say a few words.
It's wonderful to be in what we talked about. This is an idea we talked about, having this playroom, to see it in fruition, and the children having, as Dr. Ebba said, a place to go. That is when they have very few places to go. This is wonderful. So we will keep adding to this, adding more school supplies, more things to help with the children, and for them to have fun.
very limited pediatric service. There are now 4 pediatric surgeons in the country for 80 million population. And out of the 3 of them are working here, only one is working in a private practice. So why we are concentrated here now, it's a tactical approach. We are going to start fellowship program in Ethiopia. That's the only way out to solve the human resource need of the country. The main serious problem we have is human resource. We don't have pediatric surgery. Number 2, we are also flooded by large number of patients, and also and the other problem is pediatrics is also resource consuming, expensive discipline, pediatric surgery. So it's also we always run out of shortage of consumable materials and also equipment as well. So if we address pediatrics problem in the country, or if we address surgical problems in the country, we are addressing surgical problem of the children. That should be the focus around it. Even in Black Line, from our study, it's 40% of the surgical activities is pediatric surgery. So we have 40% of the problems. So, but we have only 3 people compared to 45 surgeons working in the hospital. So it is a very serious issue. Human resource, materials, consumable materials, and also material like equipments like anesthesia machines, operating tables, and also we're also shortage of also very fast-going items like stitch and other things.
Thank you, Dr. Eba, for coming and visiting our institution. Really, I would like to appreciate your activities in our department, and you are of great help to us. So as you have seen, the children's play room is well organized and it is well furnished, and also the library is well equipped. The computers are in place, but the problem that we have is the computers are not internet connected. Probably it is our own problem. The materials are already bought, and it is because of the technicians that it is late. So we have a good library now, and we still need textbooks, reference materials, and especially the postgraduate students do buy their own textbooks, though it is expensive.
Right.
I think the biggest challenge is generally having the right infrastructure with the right organization, with the basic monitoring equipment, the basic medications. Some of them we have, maybe not on a consistent basis.
Okay.
And so the biggest challenge is kind of keeping a consistency in the daily work of the standard, the practice, the nursing standard, the hygiene across the board. I can't say that it's just within the doctors no. I think when you try to raise a level, you have to start from every aspect of it, and I think that's always a challenge. And with the medical part, I would say sometimes it's the monitoring, sometimes it's the urgency that lacks.